Good afternoon, and welcome to the Florida Priority Summit panel on healthcare, public health in the pandemic, what comes next? I'm Mindy Marquez, executive editor of the Miami Herald and El Nuevo Herald, and Florida regional editor for McClatchy. On behalf of the teams at the Miami Herald, El Nuevo Herald, and the Bradenton Herald, as well as our parent company, McClatchy, I welcome you to the second in a series of panels that grew out of a Zoom-based summit we held in August with our Florida influencers. This event and series wouldn't be possible without the generous support of our sponsor, who cares deeply about our state and the exchange of ideas. Baptist Health has generously supported the project and is the presenting sponsor for today's summit. I would now like to share with you a message from Baptist Health.
These past several months have been unprecedented for all of us. We've faced challenges unlike any we have faced before as a community and as a healthcare system. People on the front lines, from healthcare workers to supermarket employees, have put themselves at risk to serve others. At Baptist Health, we're so proud and grateful to our healthcare heroes who have given and continue to give their all every day to ensure that our patients receive the care they need and that we, all of us, come together to stop the spread of the virus. Through it all, we have felt South Florida's support. Our community has been right there with us in this fight, and for that we are grateful. But we're not done yet. We each need to remain vigilant and protect ourselves and others by wearing face masks and practicing social distancing. For those who need health care at an urgent care center, an emergency room, or on a mobile device, you can rest assured that procedures are in place to provide safe care where and when you need it. Thank you, South Florida, for trusting us with your care. We are proud and honored to serve you.
Thank you, Joe, and thanks to Baptist for their support. So who are the influencers? They are 50 engaged citizens from across Florida who are involved in every aspect of civic and economic life, from social work to education to healthcare to growing our economy. They work in affordable housing, building our economy, educating our young, and protecting our elderly, and in every way represent the diversity, creativity, and energy of our state. Each of the past 3 years, we've brought a class of influencers together to help us put a fine point on the challenges in healthcare, education, the economy, and social justice. Between now and the end of the year, we'll follow up their deliberations with 4 live stream panels, one on each of those broad topics. We hope those sessions will allow people to step back from the minute-to-minute, hand-to-hand combat over politics to have a thoughtful discussion about the issues and possible solutions. And today, in the midst of the COVID-19 pandemic, we look at what comes next as our state and the country continue to battle this crisis and try to look ahead at the future of our healthcare system. We start with a conversation with a truly special guest. Dr. Vivek Murthy, the 19th Surgeon General of the United States and someone with very close ties to South Florida. Dr. Murthy, in 1978, the family crossed the Atlantic, first to Newfoundland, and when Dr. Murthy was 3, to Miami, where his parents established their medical practice. Dr. Murthy was raised and completed his early education here, graduating as valedictorian from Palmetto High in 1994, and he was the Miami Herald Silver Knight in General Scholarship that same year. He went on to Harvard as an undergrad and then to medical school at Yale, where he next earned an MBA. Dr. Murthy became Surgeon General of the United States in 2014, appointed by President Barack Obama, and he served until 2017. In his experience as a doctor, first as a hospital resident in Boston, and in his later role as Dr. Murthy began focusing on the link between social connections and our health. He spoke about it across the country, he wrote about it in medical journals, and he continued his effort to understand loneliness, leading to his book, Together, The Healing Power of Human Connection in a Sometimes Lonely World. That book, published just as COVID-19 was unfolding in the United States and across the world, and most Americans were under orders to stay at home. So, Dr. Morthy, perhaps we can start our conversation there. In the foreword of your book, you describe the impacts of sheltering at home, canceled play dates among children, barriers to meeting with friends, or even visiting our elders. You take issue with the term social distancing. Can you explain why?
Well, absolutely. I mean, first of all, let me just say how nice it is to be with you and how special it is for me to be here with the Miami Herald. This is a paper I grew up reading every day as a child, and I would hurry out, as soon as the paper came, I would run to get it. I would take it out of its plastic cover, and I would turn immediately to the sports section, always looking for updates on the Miami Dolphins, hoping that they were doing well that year. But it's a real pleasure and a special honor to be here. And particularly at this time when we are in the midst of this pandemic and struggling with a number of issues, including the separation from one another. You mentioned the term social distancing. And, I tend to think of what we've been asked to do more along the lines of physical distancing, to separate from one another. But social distancing connotes that we are also separating from one another in terms of our relationships, that we are growing more distant and less connected than we were before. And that can happen as a result of physical distancing if we're not careful. But I do think in this pandemic, what we're called to do is actually find ways to double down on our relationships, even if it's virtual, even if it's by phone, and to find ways to strengthen our social connections, even though our physical distance may in fact be growing.
So in your book, you write about a listening tour that you began shortly after becoming Surgeon General and how you were influenced by those stories you heard. Can you tell us about how that shaped your work and what common themes emerged?
Absolutely. I spent a number of years in medical training and in medical school residency the years afterward. And interestingly enough, I never really learned about loneliness and about what its consequences were, about how to deal with it. And even though I had actually experienced loneliness in my own life, in my own childhood, and even though I had seen it, as a doctor taking care of patients, I didn't quite understand what the health consequences were. But when I began my tenure as Surgeon General, I began with a listening tour, traveling to small cities and big towns all across America. And there, what I did is I just asked people simple questions in the beginning, like, how can I help? And I tried to just sit back and listen. And what I heard on the one hand would not surprise you. I heard stories about addiction and substance use disorders. I heard from parents who were worried about depression and anxiety in their kids. I heard from people who were concerned about violence in their neighborhood and weren't sure how to protect their kids. But behind those stories were these threads of loneliness, where people would often say, I feel I have to deal with all of these challenges on my own. Or I feel if I disappeared tomorrow, no one would even notice. Or I feel invisible. And hearing that time and time again made me realize that there was something bigger happening. That loneliness, which I had encountered myself and seen in my patients, was far more common than I had thought. And if you look at the data now, it really backs that up. We look at surveys, for example, which, when I was looking into this, showed that around somewhere in the neighborhood of 22% of adults were struggling with loneliness in the United States. That's more, keep in mind, than the number of adults who have diabetes. That's more than the number of adults who smoke in the US. But more recent surveys have put that number much, much higher, at closer to 50%, according to a recent Cigna survey. And it turns out one of the peaks of loneliness happens to adolescents and young adults, the generation that we think of as most deeply connected through technology. But it turns out that how we feel, whether we're lonely or not, is a subjective feeling that's not determined by how many people we have around us. It's based on how we feel about the quality of those connections.
I was going to ask a little bit about what, and again, you wrote a whole book on the topic, but what are the key factors you believe are really contributing to this feeling of loneliness? You mentioned technology as one. What else did you find?
Yeah, it's a great question. And, I think there are several factors that are driving this. I think, one, we've certainly become more mobile over time, which has had amazing benefits in terms of being able to move for jobs and for great opportunities. But it's also had the consequence of taking us away from communities that we have grown up with and come to know. The second area has to do with technology. So technology at the end of the day is a tool. We can use it to strengthen our connection or to weaken our connection. But if we look at the way in which we use technology, it can be very instructive. So take, for example, if I was flying to New York and I posted on Facebook that I'm going to be in New York, is anybody free for lunch or dinner on Wednesday? And a couple of friends responded and we met up in person. That would be a great way, of converting online to offline connections. If I use video conferencing technology to talk to my relatives in India or in other countries around the world, it's a great way to stay connected, a method I didn't have available when I was growing up here in Miami. But what it worries me is how we use technology now predominantly, which is we allow technology to often infiltrate our conversations and connections with others. So it dilutes the quality of our interactions. Every time we pull out our phone to check our email or to scroll through our social media feed while we're talking to somebody, that's what we're doing. We also can crowd out our interaction with others as a result of just being in front of screens a lot. And there's one more, I think, factor here that I should mention that dovetails with technology, but it's a larger cultural factor that I worry about, which is in the modern day world. And this is not a phenomenon just in America. We're seeing this all over the world as societies modernize and take on a set of sort of modern day values, is that we have defined our self-worth not necessarily by intrinsic factors, but by extrinsic factors. We've said you are worthy, you are valuable if you are successful. And you are successful if you've acquired one of three things: wealth, power, or fame. And those are the messages that our kids are absorbing. It's why many of them see the acquisition of fame and power as the definition of success and worth. But the reality is that we know that an individual's worth is actually not tied to those things. Our worth is fundamentally tied to our ability to be kind, to be compassionate, to be able to give and to receive love from those around us. That's what makes a good neighbor. It's what makes a wonderful life partner, what makes a great citizen and community member. But we're not teaching that as rigorously, as consistently to our children. And because of that, I think we're seeing many, many young people now with a diminished sense of worth. And here's the key and how this connects to loneliness. When your connection with yourself is weakened, when you feel uncertain about your own worth and value, it actually makes it harder to connect to other people, because in your interactions with them, you are second guessing yourself a lot. You're worried about how they're perceiving you as opposed to showing up as your authentic self. And that fundamentally is why our connection to other people is built on a strong connection to ourselves.
So that leads me to another question for you. You grew up in Miami, and by most measures, you were immensely successful as a teenager at Palmetto High, earning high honors, including, as we mentioned, our own Silver Knight. But you describe your internal narrative as having been somewhat different in your book. So how is that so?
Yeah, so it was a complicated experience I had growing up in school. But I will say, as part of an immigrant family that came here with very little resources and no connections, we were the beneficiaries of a wonderful community in Miami, a community that, particularly in the school system, blessed my sister and me with teachers who really looked out for us. We are the product of public schools, and very proud of having gone to Miami-Dade public schools. And speaking of the Silver Knight, I still very vividly remember the night that I was blessed to receive that Silver Knight award. But what I remember in particular is being in that auditorium downtown and having my teachers there. They showed up because they wanted to be supportive. They didn't know if I would win anything or if any of the other representatives of our school would, but they wanted to be there to support us. It wasn't in their job description, but it was what they brought to the table and what they blessed their students with. And so I count myself as very lucky. But at the same time, I struggled a lot, especially in elementary school and middle school, with feeling very lonely in school. And the reason was I was extremely shy. I like to hang out with other people, but it took me a while to actually make conversations. And I had self-esteem issues. I didn't necessarily feel confident in who I was. I was very aware of how different I was from other people. The fact that, I looked different, that I had a funny sounding name, that the food that my parents made at home looked and smelled differently from the food that other people seemed to bring to the cafeteria. And all of those made me feel like I was an outsider rather than an insider. And each day when my parents dropped me off at school and I went to Pinecrest Elementary, I remember still that pit in my stomach that would form because I was just feeling scared about walking into school and being alone in the classroom or on the playground, or worst of all, in the cafeteria at lunchtime. So that was very difficult. But and there's one last thing I want to mention about this, because it is so relevant to so many of us who struggle with loneliness, which is that the loneliness that I felt, I at the time I thought I was the only one. I have since recognized that there are so many people who struggle with loneliness, and did actually, or right around me. But loneliness is a great masquerader. It looks like different things. It can look like anger, as it often does in men. It can look like irritability. It can look like being withdrawn. It can look like depression or anxiety. And because of the stigma surrounding loneliness, unfortunate stigma that tells us somehow that being lonely means you're not likable or not lovable, that makes us think that we should be ashamed of being lonely. So that, in fact, deepens the experience of loneliness. And it took several things for me to emerge from that deep well of loneliness. It took the opportunity to meet some really wonderful people in high school who I became good friends with. It took building confidence, which I have to thank my teachers for and my parents for, who really helped me recognize that I had true value as a human being over the years. But it was a process, and I recognize there are a lot of people out there struggling with loneliness. I want you to know that you aren't alone in your loneliness, and the fact that you're lonely does not mean that you are broken in any way. Loneliness is a natural human response, a universal response that we all feel when we're lacking something that we need for our survival, and that's our connection with one another.
Thank you for sharing that personal perspective with us. You suggest that loneliness is also connected to other health issues. Can you talk a little bit about that?
Well, absolutely. And this was really fascinating to me when I was a Surgeon General, because I was encountering all of these stories of loneliness, keep in mind. And what I was wondering about is, what's the impact of this loneliness? I knew it made people feel sad, and it made them feel less than good. But what consequences did it have beyond that? And this is where I was really surprised. Because looking into the research literature, what I found is a number of studies that have demonstrated over time that loneliness has consequences to both our physical and mental health. It turns out people who struggle with loneliness are at increased risk of premature death, of heart disease, of dementia, of depression, anxiety, sleep disturbances, and the list goes on. It also turns out, if you look at the mortality impact, the amount by which one's life is shortened on average by loneliness, and you look at this in large sort of meta-analyses, what you find in one particular study that was done by Julianne Holt-Lunstead at Brigham Young University is that the mortality impact associated with loneliness is actually similar to the mortality impact you see with smoking 15 cigarettes a day. It's even greater than the mortality impact that you see with obesity or with sedentary living. And I say this to you as part of the legacy of surgeons general who have had basically worked in an office that has focused for decades and decades on those three issues: smoking, obesity, sedentary living. Yet it had not occurred, I think, to many of us that loneliness may be an issue of great public health consequence. But I believe it is, and I believe the data really supports that conclusion.
So in this time where I think we're all feeling like a baseline malaise, I would just call it that, or maybe like just like depression, or certainly can relate to all that you're talking about. You discuss key strategies, with this current crisis, and also possibly what you termed a social recession. Can you tell us more about that?
Well, absolutely. My worry right now is that if we do nothing different, if we allow this pandemic to separate us more and more, not just physically, but if we allow the politics around the pandemic to separate us from one another, to doubt one another, to become skeptical of one another, then I worry that we will become lonelier, and that deepening loneliness would lead to what I think of as a social recession that will have consequences for our health, for our performance, and for our ability to come together as society to overcome big challenges. And those consequences will be just as important as the economic headwinds that we may be facing. But I don't think it has to be that way. I think we can use this pandemic we can use this pandemic really to engineer a social revival. And that's a choice. It's between a social recession and a social revival. And the way we use it as a source and as a motivation for social revival is we use this pandemic to stop and to think about our lives, to take stock of our relationships, and to ask ourselves, where do we truly get our greatest joy and fulfillment from? What is our highest priority? And the answer for many of us will ultimately end up being our relationships. We know when asked, what's your most important priority in life? It's often our kids or our spouse or our parents or our best friends. Yet the question is there a gap between the priorities that we state and the priorities that we're living? I know that for myself, there has been a gap. That for years I've said that my priority is people, but in reality, when I examined my life, when I took a really hard look at where I was putting my time, attention, and energy, it was much more toward work and toward achievement. And I've realized, in part because of this pandemic, that I want to change that I want to close that gap. And there's some simple ways we can do that, even though we can't see each other. Number one, we can make it a point to spend 15 minutes each day connecting with people we care about. That could be a video conference call. It could be just calling them on the phone. It could be writing to them to say, I'm thinking of you. I want to know how you're doing. The second thing we can do is we can keep the time that we do spend with others high quality. We can make sure that we are giving people the benefit of our full attention by eliminating distraction. And what you'll find is, as easy as it is to get distracted during conversation, that 5 minutes of conversation where we give someone the benefit of our full attention can be more powerful than 30 minutes of distracted conversation. The third thing we can do is we can seek each other out, looking to serve. And why is that important? Because it turns out that service is one of the most powerful antidotes to loneliness that we have. Because when you serve other people, not only are you building a positive connection with them and shifting the attention from yourself, where it tends to focus in loneliness, to somebody else, but you're also reaffirming to yourself that you have value to bring to the world. And in this age of COVID-19, service can look like checking on a neighbor. It can look like calling a friend who you knew was struggling before the pandemic hit. It can look like delivering food to a coworker who you know is struggling to make it all work and with teleworking and homeschooling their children. It can look like offering to virtually babysit, even for 10 minutes, for a fellow parent who might be struggling. So these are all three simple but powerful ways that we can strengthen connection in this age of COVID. And I lastly want to say, I wrote this book on loneliness, but I ultimately became fascinated by the power of human connection. I think that in a world where we're fascinated by new medicines and new technology, I think that sometimes we have lost sight of how powerful our connections with each other really are, that they are an extraordinary source of healing. And I emerged from this whole journey exploring the topic of loneliness and social connection much more hopeful than ever about the future. Because in people all over our country, I saw fundamentally men and women and children who were full of kindness and decency and compassion and love. I saw the generosity of teachers who reached into their own pockets to buy school supplies for kids who couldn't afford it. I saw neighbors who reached into their own pockets to help their other neighbors because they knew that we were all struggling during the pandemic. People have stepped up to help one another. And in these moments of crisis, we see what we're truly made of. But this is our opportunity fundamentally to recenter our lives on human connection, to build people-centered lives. And we do that by focusing and doubling down on our relationships. And I hope that will continue long, long after this pandemic is over.
Thank you so much, Dr. Murthy. Clearly, I think you've just brought home, I think, what all of us have experienced during this pandemic, that, it's time to realign our values and focus on, like you said, the people who matter most to us in our lives. And so I really appreciate having you here today. And for more, obviously, Dr. Murthy's book is available and it's fascinating. So I would highly recommend it. Thank you. And now I'd like to introduce Amy Driscoll. She's the Herald editor who oversees our health coverage, and she will be moderating our next conversation today. Amy?
Thank you, Mindy. Today, we have gathered a thoughtful and engaged panel with important insights and opinions of how we move forward in the coming days, months, and years. The COVID-19 pandemic has shed light on the disparities in our public health and economic infrastructure. Mitigating these impacts requires a concerted effort and investment from our state's leadership. How can and should Florida invest in its public health resources and infrastructure to recover from COVID and establish a stronger system to meet future needs? Our conversation will feature key influencers, medical professionals, and local policy leaders. And as we discuss policies and ideas to answer the key questions, this conversation today will come back to one thing: solutions. We hope these discussions bring you insight and add value to your conversations and encourage change in your communities. Let me introduce our panel. Penny Schaefer is the Florida Blue Market President for South Florida, and in this role, she is responsible for the company's business operations in an 8-county region from the Keys north to the Treasure Coast. Dr. Eileen Marty served as a naval officer for 25 years and has more than 40 years of clinical and research work in the fields of infectious disease, public health, outbreak response, and mass gatherings. She also works with the World Health Organization and has responded to disease outbreaks around the world. Dr. Marty is co-editor-in-chief of One Health, the official journal of the International Federation for Tropical Medicine. Dr. Suzanne Doblecki-Lewis is an infectious disease expert, associate professor of clinical medicine at the University of Miami, and an alumna of the Master of Science in Public Health program in the Department of Public Health Sciences. She is also leading the university's participation in the COVID-19 vaccine clinical trial. And we also have with us Dr. Sergio Segura. He's the Chief Medical Officer and Emergency Medicine Physician at Baptist Hospital. He is a board-certified emergency medicine physician licensed in Florida and Pennsylvania. He was selected as chief resident during his residency and president of the medical staff, as well as awarded fellowship status by the American College of Emergency Physicians. With over 30 years of experience, he has been recognized by peers and hospital administrators for his leadership and clinical excellence. Thank you all for joining us. We have a nice wide variety of perspectives here. So I'm going to ask this first question of all of our panelists. We'll go one by one. It became pretty clear early on in the pandemic that surveillance systems, the ways we count and track infected people to chart the path of disease and determine resources, aren't working well. There's no common system for collecting, reporting, and the key information that would help governments control disease. And as we go forward, is there a more coordinated surveillance system that Florida should invest in to combat diseases like COVID-19 in the future, or is there a more pressing need? I know you're coming from different perspectives on this, so let's start with Dr. Marty, and perhaps you can give us your perspective on that question.
Well, thank you for inviting me, and I'm a big fan of Baptist Health and of the Miami Herald, so it's an honor and a pleasure to be here. You've asked an incredibly challenging question, and throughout my years working for the federal government, both as a military physician and in other duties as assigned, I always took the perspective that prevention is the way to go on all things, and good prevention includes good surveillance as well. I think Florida actually does a remarkable job overall in gathering statistics on health and health discrepancies. And those data are generally well published. Now, when it came to this particular problem, this COVID-19 pandemic, it really was at the federal level where and the connections between the federal and state and local that didn't jive in the ways that we normally are able to do so. So it became a problem because the tools and the resources and the mechanism for doing the appropriate surveillance didn't materialize from the sources that it needed to come from in the first place. And I know that's an obscure way of addressing the issue, but I think you understand what I'm saying.
And Penny Schaefer, could you perhaps, from a different perspective, you're coming from the insurance industry, tell us, what do you think needs to be done?
Well, I think there's undoubtedly the opportunity for process improvement always. The fact that protocols exist is important. Improving those obviously is important. Compliance is important. But we have to remember that this was a fairly unique situation. First, finding a test that could actually detect and continuing to develop testing mechanisms took time. We certainly had undetected cases because there were no symptoms in many, many cases. And so I think this one presented some unique opportunities for us to understand just how prevalent it was and in fact, the ability to understand how prevalent it was going to become as people made contact. So I certainly don't think it's the last time that we're going to encounter something that we don't know all of the details about it coming into it, and things are going to develop, and we have to be prepared and agile enough to handle those developments as they come across. Thank you.
And from Penny Schaefer, I'd like to go to Dr. Dublecki-Lewis. You probably have a different kind of perspective on that question.
Sure. So thanks for the opportunity to participate in this panel, this interesting discussion. So I think, your question about where do we go from here regarding surveillance is a good one. We've certainly seen it evolve so much already during this short time that we've been dealing with this pandemic. And we all remember in the early days when hospitalizations were enormous and hospitals were overrun. And if you look at the case numbers, for example, from New York, they seem to be low compared to some of the numbers we saw later. And we know that that's just not the case. It was a lack of testing at that point. And I think it would be a very good aspiration to get to the point where testing is available and surveillance testing is available in a way that was truly reliable, and we were able to get a good, sort of baseline and ongoing idea of where we stand. And I think as technology evolves, this will become more and more feasible. And the idea of being able to have testing that's returned in a reasonable amount of time so that we can act on it in terms of protecting those around someone who is positive for COVID and preventing ongoing transmission. In some ways, this is still a bit aspirational, but I do think it's worth investing in because as we go forward to a time when we're continuing to live with COVID, we will need these tools in order to be able to manage our lives, to be able to make reasonable decisions about what's opening and what's closing, and to prevent cases from becoming clusters and ongoing outbreaks. So, I do think it's worth the investment still and very important. I don't think that COVID is something that's going to be going away immediately, and we need all the tools that we can bring forward in order to, make our lives as reasonable as possible given the circumstances and to really minimize the ongoing transmissions.
And Dr. Segarra, from the Baptist perspective, do you feel as though you have had enough access to data and information that was coordinated in a way that helps you figure out what to do and how to treat your patients?
Yeah, we were fortunate in we were able to get enough information from the state, and not only the state, but the other hospitals in the region collaborated very well in finding out what our numbers were and estimating what was going to be the ultimate number. We did do a lot of preparation early on in April after seeing what had happened in New York. And we had a minor spike in numbers. And however, what we were not prepared for in terms of the amount of patients we were going to get in late June, early July, mid-July. Fortunate that preparation that we had done for the April, we were able to roll it over into July, August, and we were able to provide the standard of care that is expected from our community.
I'd like to follow up on something there, Dr. Segarra. You mentioned the sort of sharing of information that happened locally among hospitals. Is that something that you think could be replicated elsewhere? Was that helpful to you in planning and coordinating with other hospitals to shift patients if necessary or share resources?
Yeah, I was more involved in the inter-hospital. Baptist is a large system. It has 11 hospitals, and we were able to share that information. But our CEO and our COO was able to, at the corporate level, talk to our colleagues at University of Miami, at Jackson, and HCA here in South Florida. So we were able to have a coordinated event in Dade, and then the chief medical officers spoke within the region so that we had an idea. We also collaborated on a national level. I spoke with the chief medical officer at Northwell to see what we could learn from them during our spikes that we got. And a lot of it was good information that we were able to get from a national level. But we do have to do better in disseminating that information and preparing. You know, as an emergency medicine physician, spent a lot of time in doing drills for nuclear events, doing drills for mass casualties, but we never prepared nor drilled for a pandemic. And that's something that, you know, having two infectious disease docs, I really appreciate their information because it's something that we need to add to our preparation.
And also, I'd like to follow with Dr. Marty on that question as well. Dr. Marty, you said that you know, that there was a certain level of information available to you, but was it enough?
Look, there's so much that you have to prioritize here. Let's start with, we had, especially after 9/11, when I was part of the whole stand-up of the Department of Homeland Security and the development of our national incident management plans and systems and so forth that we had in effect. In Florida, we had all these Florida teams from all the different regions, and we did drill for pandemics as well as everything else. We had plans, we had a national strategic stockpile. Those are the types of things that I was referring to, pre-positioning things, working with hospital systems like Baptist that use up the supplies in the national stockpile while we keep it filled up and up to date. There were systems in place that had been dwindled over the years. So it's not a political thing, because both parties dwindled the supply of expertise, of teams, and of the national stockpile, which would have made a huge difference in this pandemic. And those kind of preparatory actions are something that every state needs to get the federal government to cooperate with them in setting up. At FIU, we have the FIU FAST team, which we sponsor because the funding at the higher levels sort of disappeared. And we recognize the importance of having these ready units to manage crises as being fundamental to minimizing the footprint of any type of outbreak. And we mentioned earlier the testing, and I want to emphasize that Christian Dorsten's team at Charité Hospital in Berlin had developed an excellent set of primers for detecting the SARS-CoV-2 virus early in January, soon after the initial publication of the sequence. And that technique was offered to us for free to the United States, and we chose not to use it. Then we had a tremendous amount of problems because of underfunding. Again, it's all about underfunding our public healthcare systems. That's put us in the position that we're in, coupled with another series of problems that I'm not going to go into. But truly, we didn't need to have the number of over 215,000 people who have died in the United States from this virus had we employed the teams and processes that we had the expertise and the manpower and the knowledge to do.
Well, thank you for that. I appreciate the sentiment there. I want to switch a little bit toward solutions again. The drive for a vaccine continues at an unprecedented pace. It's obviously something that, you know, everybody is waiting for, you know, after many months of suffering. Dr. DeBlecki-Lewis, you're leading the university's participation in one of the trials for a vaccine, the one being created by Moderna. Could you talk a little bit about that for us? What are the prospects for that trial at this point? Is there any hope for a vaccine at the end of the year? Bring us up to date on where that stands, because it's certainly something that everybody is interested in.
Sure. Yeah, I'd be happy to. So, I think you're right that vaccine, I think one of the things that I like about working on vaccine is that there is a glimmer of hope, right? Not that it's going to be the end, not that it's going to cure it all, but at least something hopefully that will allow us to move forward. So I am the site PI for the Moderna vaccine here at the University of Miami. We're still in the enrollment phase. Enrollment's been going well, and the enrollments will wrap up over the next couple of weeks. We've been tasked with and focused on our enrollment here representing the diversity of South Florida, and I think we've been very successful in that regard at our site. And the thing about vaccine trials is that you do your best to enroll a good trial. We tried to do it quite quickly, and because speed is, as you mentioned, of the essence, and everything about this has been moving quite quickly. But once we have our participants enrolled and the vaccines are given, it's really a waiting game. And I think it becomes a black box. We really don't know until the data are looked at overall and nationally whether the vaccine is working, how well it's working. And we also don't know how quickly we'll actually get that result. It depends on the number of events, meaning infections that occur across all of the participants in the trial across the United States. So, as you've heard in the news, I think there's a lot of speculation about when that might happen, but the fact is that no one really knows. I think the best estimates based on sort of projections and epidemiology and enrollment is maybe by the end of the year. But that's really speculation because it does depend on a lot of moving pieces. I guess on the positive side, we've seen really nice data from the phase 1 and phase 2. This is sort of the early trials that are done in smaller numbers of participants, looking more closely at what we think are the endpoints that correlate or are associated with what we think would be protection from a vaccine. And those early studies look good for a number of the vaccine candidates. So I think we have quite a few that are coming along and may be promising, and we have reason for optimism in that way. But the proof is really in the pudding in the phase 3 trial, the trials that have thousands of participants. And there's just no, once you do your best to enroll a good trial to get good data, and it's really a waiting game, and we're all in that waiting game at this point. So hopefully, like I said, I think we'll be very, very happy if there's an answer at the end of the year.
As I think everybody would be. And of course, we don't know what level of protection that would offer yet, but I'm sure
all unknowns at this point. So, and of course, if one of the vaccine candidates that's in phase 3 now turned out to be very effective, we would have an answer a little bit earlier than it's something that's just a little bit partially effective. But we don't know, or we really just can't tell until we have the data. So it's a waiting game.
Right. And in a related question, during the pandemic, public health departments have had a hard time getting people to take measures as simple as a mask to cut transmission. Given that level of reluctance, if and when a vaccine is developed, what can be done to give the public confidence that it's safe and will work? Dr. Segar, let's start with you.
I think we need to be transparent. We shouldn't rush anything, outside of our standards. We've been working very diligently at Baptist. We're prepared to be a dispensing site for a vaccine when it becomes available. But that has to be, we have to gain the community's trust that a vaccine is good. And in the interim, we have something, that's better than a vaccine because we don't have a vaccine, and that's the mask. And we need to encourage people to continue to use that while a vaccine is being developed. That's the only way we're going to keep from having, 300 or 400,000 citizens that pass away.
And Dr. Marty, what's your perspective on how we can help give the public confidence that a vaccine will work when we develop one? Dr. Marty's muted.
Messenger. who is the messenger? That's one of the most important things, is to make sure that the information that the public receives about the quality of whichever vaccines we have quality data on is being provided by a non-interested party who has the science and the knowledge to be able to understand both the safety and the efficacy. When a vaccine, generally, we want to have at least 80% efficacy for a vaccine. Although for COVID-19, they've lowered the bar to closer to what we actually have for most flu vaccines, which is tolerable for flu and would still be helpful towards this pandemic, say it were 50% efficacy. And I would have to explain that, or whoever would have to explain to individuals that something that gives you a 50% efficacy means you probably still have to wear a mask. And then they would want to know what the value of that is. And then the other part is the safety issue. So let's just break down a little bit of what we heard just earlier about what's going on with the Moderna vaccine here in Miami. What they're doing is they've done one of the hardest parts, which is to enroll people in the program. They haven't yet actually begun to collect the data on the results of having given placebo or this dose or that dose. And they don't yet have the information, of course, because they haven't begun that part. They're still doing enrollment as to how long any immunity lasts, what kinds of immunity, whether or not there's, all the details that go into whether or not a vaccine works, going beyond, in this case, knowing just about neutralizing antibodies, but other details on T helper 1 cells and T helper 2 cells and so forth, so that we could then translate that data to the public in a way that I can say with confidence, hey, people are not getting any serious bad effects from this vaccine, and you're going to get a level of protection that's worth your taking the risk of taking this vaccine. So you have to combine all these concepts at the same time in order to be able to get people to understand that a particular vaccine, and by the way, it may not be one vaccine. We've had conversations with vaccine developers who are actually talking about maybe using 2 vaccines, and parallel vaccines in the same individuals. All of this is data that we're still trying to collect. It's a complex problem where the Moderna vaccine that's being tried here at the University of Miami, and go UM, yay for the U for what you're doing. But the reality is it's a brand new technology for humans. We haven't had a vaccine based on a little bit of messenger RNA in a lipid capsule as a way of vaccinating. We have no idea what the pluses and minuses are ultimately in humans, because the human immune system is different than the immune system of pigs, horses, cattle, mice, what have you. And so it's very important to do these trials in humans to get a real understanding of exactly what happens and for how long these things are beneficial. And yes, there was a report today that Johnson & Johnson has stopped its vaccine trial, just as AstraZeneca did earlier, because of a complication. Those are very different vaccines than for example, the one that's being tried at UM. Those are based on adenoviruses, either reproductive or not reproductive adenoviruses. So that's the other thing that we have to clear up in people's minds, is that there isn't a vaccine for COVID-19. There are many in trials at different levels of trials, and some have risks and some may have no risks. Some may be terrific at efficacy, some may not. And we need, as Dr. Dubinsky said very beautifully, we need the data. Until we have the data and we're convinced, it's very hard for those of us who work with vaccines and work with patients to turn around and give a solid answer as to which vaccine they should take.
Right. Understood. And Penny Schaefer, I'd like to bring you into the conversation. How will the insurance market be affected by a vaccine when it happens? What plans is your industry making to handle the unknown costs of this pandemic? Could a vaccine play a role in reducing the long-term effects and therefore cutting costs?
So that was about 6 loaded questions.
Pick whatever you'd like to answer.
Yeah. Well, the first thing is, to harken back to the point just made, will it be a vaccine? Probably not. And so one of the things that we will all face is, as soon as there is a first vaccine, whatever is first to market, of course, many, many people who have been desperate and afraid will want that vaccine, whether it's necessarily the right one for them or not. So part of what we will have to do is be measured in how we work with the medical community on what is the right set of vaccines, what are the right conditions under which those vaccines should be given to the right people. And there'll always be pressure on us, to give anybody any vaccine that becomes available. And we find that with other medications and other treatments that come around. So there's certainly that. I fully expect, even if it's an array of vaccines, there'll be some short-term cost, of course, with mass distribution. So there will, without a doubt, be an increase. And of course, we expect that. We wouldn't want to withhold the vaccine from anyone where it's appropriate to be distributed. And so we expect a short-term spike in that without a doubt. The long-term benefit, however, is, to avoid the devastating impacts that we have seen, extended episodes of care, expensive ICU, the unknown impact that this disease or this virus is having on organs and function. And we don't even know yet what the long-term impact is and recovery is, simply because it hasn't been around long enough. And we're still studying, the medical community is still studying those things. But the fact that there would be an efficacious vaccine is helpful to the individual, obviously, helpful to their health long-term, and it's helpful, frankly, to our economy.
Thank you. President Trump, we can't have this conversation without discussing the fact that the president got COVID, was diagnosed October 2nd with COVID-19. And yesterday, 10 days after that initial diagnosis, he was in Florida at an outdoor rally where people in the audience told reporters they felt emboldened by his quick recovery. In addition to provoking a discussion of the aggressive treatments the president received, it also became clear that the rapid testing of the people around him wasn't enough to keep him safe. Going forward, what kinds of lessons should Americans or can Americans draw from that very high-profile example, if any? And Dr. Doblecki-Lewis, perhaps you could start with that. I know you're an infectious diseases expert, and perhaps you have some thoughts on that.
Sure. So I think it's an interesting case scenario. And I think there's a lot of value in mask wearing that's been revealed by the president's situation. I mean, this is wearing masks works. Social distancing is helpful. Not having gatherings is helpful. So I think the outbreak that's occurred at the White House is not surprising in that way. It's very difficult to take much from the president's own illness and recovery. I think there's a lot of missing information. And those of us who were kind of watching from afar as this unfolded, I think still have more questions than answers. So it's really hard to take too many lessons learned. I think and people have very reasonable questions about the treatments that were received and their availability to the general public and why they were administered under these circumstances. I think it doesn't help with public trust or mistrust about what's being offered to VIPs versus what's available to the general public. So I think more questions than answers in regard to that particular scenario.
Dr. Segarra, do you have an opinion on it? Is there something that Americans should take away from this episode with the president and COVID?
Yes, that, despite, some of the, media reports and even reports coming from the president himself that, this was a minor disease, that this was, like a bad flu or not a serious illness. That's unfortunate, because at first there were people that didn't believe in COVID and thought it was a hoax. So I thought by, the president getting this would, defunct all those rumors of it being a hoax, and that the medical community and the scientific community would do this to the American people unnecessarily. Unfortunately, instead of seizing, on the moment and seizing on the importance of social distancing, of wearing a mask, it has not been, used to reinforce those, and that's unfortunate, because from a public health point, from a physician point, I would want that to be encouraged and not discouraged, that this is not a serious illness. This is a very serious illness. For the President of the United States to be taken to the hospital and receive experimental, drugs that are still within study, shows the severity of this illness, and it should not be downplayed by anyone. What the severity is. I'm glad he survived. I'm glad he did very well, but that's his experience. There's 250,000 Americans that have not had that experience and have passed away.
And we have a little more time left. I'd like to ask one more question that one of our audience members sent in. This is from an ICU nurse. I am physically and emotionally tired of COVID-19. I don't think we can take 6 more months of codes, deaths, mask wearing, and people on the street being so nonchalant. The nurse asks us, what can we do to influence others to do the right thing for our health? So if one of the lessons of this pandemic is that individual health is inseparable from community health, and the public health system needs work, what can we in local governments and health industries and cities and states do to bring that lesson home to our communities? We probably have time for a couple of you to answer that question. So Penny Schaefer, I'm going to start with you and then go to Dr. Eileen Marty.
Sure. Well, I think one of the things that we need to do and need to continue to do is remember that we have not eradicated this virus. And so the fact that case counts are dropping is promising, but we do still need to wear masks. We do still need to practice distancing. And there are safe ways to open the economy and interact, but we are not ready for business as previously usual. One of the things that has been an important part of the evolution of this virus has been the use of telehealth, and how much that has helped individuals access the care that they need from the safety and comfort of their home without fear of being infected or infecting others, and seeing more and more of that happen. But we absolutely still need to practice. We have an enterprise of 10,000 employees, and we are following the science, and our employees are not coming back to the workplace. They're working remote, and they're not coming back to the workplace until it's safe to come back to the workplace. And so we would recommend that others, use the same practice. It's time for masks. It's time for hand washing. It's time for distancing.
And Dr. Marty, we can just give you the last word here. What do you think we should be doing, states, cities, counties, industries, to encourage people to look for the welfare of everyone around them and not just themselves?
Well, first of all, I want to say thank you for having me with such an outstanding panel. It's been a privilege to listen to my colleagues because they're vocalizing exactly the message that we all need to hear. You can't look at one individual's course and determine that that's the way everything is going to be. We have a series of tools in hand that can keep the virus level down. Although I should say our hospital cases are rising again, and we are having more problems once again in Florida. And our predictions are that that's going to continue to go up for a little bit. All the more reason why it is absolutely urgent that everyone lead by example from at every level, and that we express this with this unified voice, that using the tools that we have at hand, the mask, the physical distancing, the hygiene, are absolutely critical to keeping our economy open and our lives intact.
Thank you very much. Dr. Marty, and thank you to all of our panelists for joining us today, and to you, our readers, as well. If you found today's conversation helpful, please consider subscribing to the Miami Herald and consider joining us in November when we discuss the future of Florida's economy in the age of COVID. Thank you so much.